So, with more and more people switching to natural household and beauty products, it's important to recognize that not all natural ingredients are equal. Some may have adverse effects, especially dental care products. Anaida Deti is a registered dental hygienist and joins us now. Hi, Anaida. Thanks for doing this.
Hi, thank you very much for having me.
So it really is a thing. I know people who have switched to, especially with household products and cleaners, it's all natural. I don't even know if they know exactly what's good about what they're doing and what's bad about what they're doing, but it's very trendy. So when people do that, I guess they have to be careful, especially when it comes to dental hygiene.
Of course, a lot of times, a lot of things that we use, as you said, we don't know. Like people don't usually know what they are using, so it's very important for them to ask the dental professionals so they can get an accurate answer of what they are using and to use them the proper way.
Right. So I guess especially when it comes to dental hygiene, all natural is not always the best way to go.
Yes, it's not.
Okay, so there are a number of ingredients that people have to watch out for. Maybe we can go through some of them and you can let people know, why this may not be the best choice for them. And one of the big ones, I'm not using this in a dental hygiene product, but I'm seeing this charcoal is everywhere, activated charcoal and face masks and hair products. I see it everywhere. This is very trendy. So can you get activated charcoal in dental care products too?
Nowadays people are using the activated charcoal, especially because it became so popular on the social media. So it was all over the social media, on Facebook, on Instagram, and that's why people saw other people using it and they started using it. The activated charcoal can be maybe good as a skin detoxifier or maybe as a bug bite release, but not so much for the mouth because it has so many porous qualities. It can actually eat away tooth enamel, and it can also leave a grayish color after you use it. Maybe not the first time, but if you use it a few times, definitely can give you not such a nice natural color for your teeth.
So when people are being sold charcoal and dental hygiene products, what is it supposed to do? What is it being sold as?
They usually sell it as a whitening product.
Oh, okay. And you're saying it can have the opposite effect.
Of course, yes, especially in a long, prolonged use.
All right. Now, the next one, lemons.
Yes.
I mean, with absolutely no knowledge, I would assume that the acid in lemons is not good for your teeth.
It's not.
Okay. Is that what it is? Like, how are people using lemons for their teeth?
People use the lemons because they can get a fresh breath when they use the lemons, and they think because when you eat the lemons they have antibacterial properties. So sometimes they can think that it's a good thing, and they can because of its acid properties that it has, the acid content, they think that it's going to whiten their teeth. But the lemons actually are not good for your teeth because it eats away tooth enamel. And especially for us as dental professionals, when we see some patients in the chair, in the front, top, and bottom teeth, they have very thin enamel, and then we know that they are actually sucking on lemons. That's how we know. And I usually ask, that's one of the things I ask if I see that, is usually if you like lemons. And they say, yes, oh yes, I do, because it also has other properties. It can whiten your teeth. And then when I go on and I tell them that because it's so acid, it's not good to suck on lemons for a long period of time.
Right. So you'll be able to recognize, because there are people out there who just like to do that. They love the taste of it or whatever. Yes. But you can see when they sit in your chair because the enamel's worn off.
Yes, we do, especially in the front teeth.
Interesting. Okay. How about natural chewing gum? What is it supposed to do, and is it good for you?
Chewing gum is good because it actually stimulates saliva, and it's good for people that have dry mouth. But also the gum, you have to be careful what kind of gum you use because it can cause cavities. That's why one of the best gums out there are the ones that have xylitol, which is a natural sugar, and it's very good and it doesn't cause cavities. But people also have to be careful with chewing gum. It can give you problems with the TMJ. So you cannot chew gum for a very long time. But for a certain period of time, it's actually good. But always gum with xylitol.
That's interesting. So TMJ, that's the jaw thing, right?
Yes.
Can you explain a little bit about what that is?
Yeah, the TMJ is the joint that can connects the top and the bottom mouth, like the top and the bottom jaw of the teeth. So that's why it's called TMJ, because it connects both of the jaws, the top and the bottom jaw.
And people sometimes have difficulty with that if they're chewing gum too much.
Too much, yes.
Okay.
And that's why you see sometimes when people chew gum, it actually makes a clicking noise.
Yes.
That's when we know that's causing a problem. Sodium
lauryl sulfate, where would we find this product, and what would it possibly be sold as in terms of cleaning your teeth?
This is a synthetic foaming agent, and you find it in a lot of toothpaste, also in mouth rinses, because of its foaming agent. But that's why I say to people, you have to be careful of what you use. Those little, lines that are on the cover or inside, like the tube, you have to read them and make sure that you know what you are using, because a lot of people that have canker sores or dry mouth or allergies, this can actually make them worse, and it also irritates the inside of the mouth. So people have to be very careful of what they use. And especially when they have this SLS, that is a sodium lauryl sulfate.
Okay, and I need to ask you about one that I'm curious about. Baking soda. Can baking soda be used every once in a while to whiten teeth if you brush with it?
Baking soda is one of my favorite natural products out there.
Good.
It is not that it has no negative effects whatsoever. It's one of the safest things you can use. So definitely you can use a little bit, you can add a little bit on the toothpaste when you are brushing your teeth. A couple of times a week is actually great. It helps the tissues of the mouth. It makes them, it heals them. It makes them, it makes them look better, feels better, and also it whitens your teeth when you use that, for example, 2 or 3 times a week.
Oh, okay. That's good to know. And what is the best way for people to whiten their teeth?
I usually say that the best way to whiten your teeth is the teeth whitening in the office, in the dental offices, because it's very safe to use, and it also it's supervised by the dental professional, which is great. They know what they are doing, so definitely they are going to do the best for you, and they are going to tell you exactly what's good for your teeth, for your mouth. And that's why I usually say, if you are thinking to whiten your teeth, please talk to your dental professional for the best way possible for your teeth.
Anaida Deti, thank you so much for this.
Thank you so much, Barb.
All right. She's a registered dental hygienist. And just remember, all natural is not always the way to go, especially when it comes to cleaning your teeth.